Hey guys, Andy Parsons, physical therapist out of Defiance, Ohio here. Wanted to talk to you about running today. The common myth out there is that running's bad for your joints, right? Well, that may be wrong. And in fact, a recent meta-analysis out of JOSPT seems to indicate that this is not true. This meta-analysis titled Association of Recreational and Competitive Running with Hip and Knee Osteoarthritis, a Systematic Review and Meta-Analysis from Edward Allen Tornbelly and colleagues shows that OA rates in at least recreational running groups is actually lower than sedentary controls. Sedentary controls had a rate of 10.2%, whereas recreational runners had a incident rate of 3.5% over time. Competitive runners actually showed the highest rate of OA though, with 13.5%. This was a large study and included 114,000 subjects, over 114,000. So it's a large sample that seems to indicate no, running isn't bad for your joints and in fact may be protective. The main problem with this study though is it's observational, it's not prospective. In an ideal world, a study like this would be designed, we'd select a group and would follow that group over time and see who developed OA. In all reality, this type of study of this volume would be impractical and very expensive to perform. So an observational study this large, looking backwards, gives us a lot of information to go on and can help us draw some conclusions. We just can't get causation from an observational study like this, meaning we can't say that running is protective for the joints. We can say that running is associated with lower incidence rates of OA in the hip and knee. One of the reasons that this is important in a study like this is it's hard to control for multiple confounding variables like occupational workloads, body mass, and things along those lines. So future studies maybe could be designed in such a way to compare body mass, for example. That would be interesting because you would expect that a running population may have a more preferred body mass than a non-running population. So is it the running that's protective, or is it the fact that they have a better body mass over time? The other big question in a study like this is whether or not running maybe selects for people who are less likely to develop OA, meaning you're more likely to run over a longer period of time if you're not developing OA because it doesn't hurt or you're not developing it basically. So that's sort of a chicken or the egg question, but something that should be considered in a study like this.